Hello again. It was wonderful seeing you all today in class. For those that were not able to join us, I hope that your day has been good. I want us to pick up where we left off because we got to get through this book, and my goal is to get us through that. And remember that you can always call me or email me if you have any questions or we need further either if I need to clarify or help you get a better understanding. But remember, you got this, okay? I was so happy to see y'all today. So let us pick up right here. We're going to pick up on page 362. We left off on page 362, so I want to pick back up right there. And on there where you got the central human functional capabilities, read over those, know those, be familiar with that. Now we're talking about using that when you are doing assessments, making sure, how has life been for your client? What type of condition, what kind of health is their body in? What type of physical health are they in? What are their emotions? Because when you're assessing, remember, as I said today in class, you're assessing for the whole person, not just one part. Because when we provide a place of peace and healing, so you don't want to just heal one area and without healing the whole person. Now remember, I said it's important that you might have to divide that thing up into, compartmentalize, break it into small pieces so that you can help the families reach a point where the person that you're working with. Now, if you look, and so you're asking yourself, well, what tools do we use? There are tools already out there designed for your use so that you can assess people appropriate. There's a lot of, some people, some people agree with some of the theories and some of the tools and some not. You'll have to find what you're most comfortable with. And remember, what the tools that we use are based on scientific inquiry, critical thinking, and also your commitment to lifelong learning. Are you committed to this process? It is a commitment to never stop learning. Never stop. Always continue to learn something new every day. Now, let's look on your PowerPoint. There are 5 types of assessment tools that are noted there, and we're gonna break each one of those tools down. The first one is the DSM classification system. Then one that I like that let me say this, the DSM. Most of the time you're seeing people in the master's level or the LCSW level using the DSM, because you usually diagnose mental health disorders or different things. But as a bachelor's level student, it won't hurt you to have knowledge of it. But most times, you'll see that used in the MSW level or the LCSW level or the doctoral level when you're diagnosing clients, for mental health diagnosis. But it's good to know that those tools are available, for you. Then the person and the environment system, that's one of my favorites. That's being able to look at that person and taking a holistic look at them, and not just looking at them from a place of just that situation, taking a holistic look at that entire person. Now, in your book on page 366, it started to talk about the DSM-5 and the DSM, about the mental disorders are usually associated, with different things. Just kind of note, for this purpose, you all, I just want you to know the different types of assessment tools, and so you want to read them and kind of have an idea, but you don't have to just really focus on that, but know that is available tool to help you in your assessment. Then you have the person and environment, and I'm going to break each one of them down. Then the rapid assessment, which you usually find in crisis intervention hotlines or suicide hotlines. It's a rapid. It's something that is a quick assessment so that you can gather the most information so that you can usually stop a crisis or stop something from happening. You usually find those like on crisis hotline. And then the classifications of virtues and strength. And then I'm going to tell you something, this last one, trans theoretical, the TTM. Y'all, I love that one. So you know that's going to be all over there because I think it's just wonderful. I think it'll provide some insight to us. So let's take it on down. The DSM, which it is very controversial, okay? It's used to, like I said, it's used to for reimbursement of mental health. It's also used for the treatment of individual experiencing some personal symptoms that, as a result from social or environmental or something that has happened to them, and it helps for billing purpose to diagnose with them, and it has a set of guidelines. There's a lot of pros and cons about it, but just know that that is a tool that is used. You can find more information about that on page 366 and 367 in your book. But again, just kind of read that and know that that is a tool that is used in most times in a mental health setting or in a hospital setting, and or settings where people are having some type of mental or diagnosis, and they use it because it has a set of guidelines. It has some pros and cons about it. Then the DSM focuses on the individual, and that's the thing about that. The primary focus about that, the DSM, that it does provide, and I've used it, and it provides a lot of information, but it does not give you a whole lot of insight on that person, the whole person. It just focuses on that individual and what's going on with them. It doesn't really look at the social, the physical, and the person in the environment. And so you can see how that won't really give you the whole picture, but individual work, it'll give you some guidelines to go by. And the keywords can be used to locate relevant research studies, individual clients' personal issues, symptoms, and effective interventions. And it can kind of give you some ways how to treat that individual. What is worked, what is what research says, how long the symptoms, and how to effectively diagnose them. And most time you get that from insurance reimbursement. Okay. Then you have the DSM-5. It enables identification of mental disorders and physical conditions in a single dimension. Now remember that the DSM does it in a single dimension, whereas a person and environment, it looks at the whole person and all the social and all everything. The DSM presents information about the psychosocial, the contextual, the environmental factors in a narrative description. It bases it like that. But I want you to again look in your book and look on the page 367 and 366. It can give you a little bit more information about this. This has been a long day, and I want us to go ahead and get through this. But I'm telling you now, the next week, it is my goal that on Thursday that we will meet at 1:00. I do the first 40 minutes of one chapter, and then we'll do the next chapter and the next. So we'll use from 1 to 2. That'll be our whole social work practice 1 class, okay? And we'll cover 2 chapters. So we got to keep it moving. The PI system, that provides practitioners the input and participation of client. It allows you to classify problems, the social and functional problems, environmental problems, mental health problems, and strength. Now, I want you to turn to, now how did I get past that? Yeah, I want you to turn to, there's on page 368, it talks about different domains of functioning, different ones. But then on page 370, you start at 369, and we're talking about, at the last paragraph, we're talking about the PI, the person and the environment, and it is a classification system and how it breaks it down into 5 categories. So you'll want to kind of read over that and have a good understanding of that. And then you got the RAIs, which is Rapid Assessment Instrument. And I spoke about that earlier. It's a complete assessment process. It serves as an indicator and a measure of how severe something is. And usually you'll find them like in CAGE. That's the alcohol dependency test that people use, and also drug abuse screening. And sometimes you even use them in hotlines. You know, it's that rapid. It gathers a lot of information in a short period of time, and is looking for some specific information to see if, you know, should this patient be admitted. And it's rapid. I mean, it's something that is done fairly quick. And I have this page fold down, and that's on page 371. And so if you want to do a little bit more reading on that, but that, you know, again, if you're going into a chemical dependent unit, you know, they might not have time to do the whole person and environment, but this, the rapid assessment instrument, it can be used, and it's more individual, and it have different questions that come up, you know, that they can decide whether or not this person meets the criteria for that particular program. Okay, so now turn with me to we're still on page 371, and there are 6 character virtues. And character virtues are looked at in as wisdom and knowledge, the courage, humanity and justice, temperance and transcendence. And we're going to walk all of those down, but you're going to do that in your book on your own self-study. And it talks about starting on, now this is important, on page 371 at the bottom of your book. It breaks each one of those character virtues down, and it talks about wisdom and knowledge and what that means. You know, that cognitive strength that entails their acquisition of knowledge. How much knowledge do they have? Think about when you were, I know a lot of you, I was talking on about the interview with Mr. Harris. You said, you know, we talking about some of you talked about his wisdom and knowledge, and then the courage, their emotional strength to involve the exercise will accomplish a goal. You know, how do they have the courage? How do they face opposition? How are they external? Well, how do they cope with that internally? So read over all of those, and you'll need to know what each one of those stand for. And they are found on 371 and 372 in your book. And you know, temperance, the strength to protect against you know, different things. You know, temper and temperance is two different. Temperance is whether somebody is laid back, or, you know, just how they are overall. But read those definitions, because if I told you that, then you won't read them and you won't have that in your toolbox. So go back to that page. I have listed them. I want you to read them so that you can, you know, have knowledge of what they are. You will see that again. That's very important, because sometimes you have to understand, even though the client may have the courage to come to your office, but they're not emotionally stable, ready to do the work. So you have to look at that, okay? Strength reflects in virtues may represent protective or resilient factors in relevance. For example, there are some people have protective factors. That's what keep them. Those protective factors just keep them in place, even though their world is all upside down. But they have something, and that something may be their own courage, their own temperance, their own who they are. But then there may be some people who go through some stuff, and they be like those. I like to think about. I hope y'all may remember some of the. You know those bozo clowns. Well, we used to call them. You could pop them, and then they will fall down, and they will pop right back up. Well, that's, you know, sometimes protective factors help people to bounce right back up, and sometimes those factors are based on that person's own virtues, their own strength, and that strength may be their wisdom and knowledge. Maybe it's their courage. Maybe it's their humanity. Maybe it's their temperance, and maybe it's just how their strengths to deal with, be able to function in a larger part of the world. So just know that you know, you'll need to know that that's how people back. You know, think about you. Think about all your journey. You know, how were you able to be resilient? What protective factors did you have that made you have that comeback? Every time you get knocked down, you pop right back up. Every time you get sidetracked, you pop back up. Every time something happens, now you have to listen. Doing your assessment, sometimes the client may not know that they have those things. That's why it's critical to you to be able to identify your own strength, your own place of healing. Because if you're not able to see your own place of healing, oh, honey, this is some good stuff. How are you going to see the healing in somebody else that's there for you to help? That's some good stuff. I know y'all saying, yes, ma'am, Miss Neighbors. That's some good stuff. Now, so I want you to look on that and make sure you have that. Now, this next one, I'm going to tell you, you will see this all through your exam, hopefully. The reason I say this is because this is important, and the clients don't even know where they are and what stage, but it's called a trans-theoretical model. It is, I love it, and it breaks it down into 5 components. Pre-contemplation. That's when people are thinking about change. This is where people, this is the first pre-contemplation. It is the first first stage of change, and it's on their mind to change. I got it on my mind. I want to do right. I want to change. They're thinking about it. Now, just because somebody thinking about it doesn't mean they actually move through all these stages. So then look at page 372. Let's look at that. People in this stage tend to reflect ambivalence, uncertainties, disinterest, and denial. They say they're going to change. They want to change. They may say it, but they still may be having some resistance about doing it. Okay? Just read over that. As a social worker, your first step toward change might be to help the person consider how they want to move forward. So you got all these problems, and you don't say you got all these problems, but I see that you have these and you have this going on. So what can we do to help you move forward? What would work? How could this change? And that's moving them from the next stage. See, pre-contemplation, they thinking about it. It's on their mind. They may be in denial about what's going on, and then they've talked to you about that problem. But now you need to, as a social worker, is to help them progress. How can we move to the next form of change? What's the next form? Contemplation. Now you got them thinking. Oh, I believe I can do it. I believe I can do it. They thinking about it. They're going to show up. And let's look at the next stage. Contemplation is the second stage of change. People in this stage tend to engage in data, reflection, and analysis. Here, the client is like, okay, I'm aware of this problem. Okay, I'm doing, and then they're gonna start researching it. If they research or they research, the client may not be researched like it is to us. They may start questioning. Well, what if this? What if that? What if the, and so they're really thinking about it, and they're reflecting on, well, how can I be different? There's a change. So this stage is wonderful because hold up, press to me, but the contemplation stage, it's a wonderful place to be, but you just got to understand the client they're sitting there. That's why it's so important when you're doing your assessment that you identify the client's hypotheses of why they're talking to you, and then you have to do your professional one, hypotheses, and then that's how you get to change oriented to help them get to the next thing, so that you identify the problem, then you start helping them gather data or reflect on how they can change. Then the next step, if you get that person first to admit that there's a problem, because guess what? If they never admit that it's a problem, it is going to be hard to get them to the place of contemplation, because they don't even realize that there's a problem. Now sometimes clients can get to the contemplation stage because they're ordered to do so. Like if they go to court and get a ticket, so but don't give up on it. But that gives them a time to reflect on where they were. Why am I having to go to drug court? Well, if I don't go to this class over here, I'm going to jail. Well, that make them think about that. So then there's a contemplation, and then they move on to the third stage, which is preparation. Oh, look at preparation. And all this is a part of change. And this, look at here. The transition, now let's look on here in your book. The transition from contemplation to preparation is associated with this two notable shifts in thinking. I want you to know that. First, there's a significant increase in thinking about the solution and the resolutions, accompanied by decreased contemplation about it. So this is where they like, at first they were, I'm not gonna be, but now they ain't worried about what they can't. They focus on what I can do. And guess who got them to think like that? You did. You, by using your professional assessment skill. And then the second, thoughts about the future increasingly replaces those about the past in the present. Y'all, woo-wee. That is some good stuff. Now, I really, really like that. Just imagine you got a client coming in there with a problem. They're in denial about it, but because of your expertise and your expert skills of assessing, you're able to validate you acknowledge. Let me change that. You're able to acknowledge their hypotheses of the situation, but then you do your professional hypotheses of it and discuss that with them. And then you all come together to do a contract about how this going to change. And then they begin to see, you know what, I don't always have to be right there. I don't have to always be there. So the more they thinking about, oh, what a wonderful future I'm having, that decreased ability that I can't change, it goes away. It goes away. They begin to know that, you know what, I can change. I don't always have to be here. I can move beyond my addiction. I can move beyond my abuse. I can move beyond this environment in which I came in because I can see something more. A lot of times people don't change because they don't have nothing to see. That's where you come in, is to help them to see what it will look like. And it's interesting. One of the things that I use when I'm doing some one-on-one with people, I said, well, what would it look like if you didn't have to drink every day? How do you think it would be? How would you feel? Well, how would you feel if it was? I think one of the stories, interviews I watched, it was interesting. And I don't know if it was acting or not, but the social worker in me was all up in there looking. But this this particular video, the person said that the person didn't want them driving the car, and the more the social worker talked, it became not that the wife didn't want to share the car, but this person didn't have driver's license, had ruined the car, and so how I would approach that. Well, how would it look if you had your driver's license? How would it look if you could drive to the store and not worry about a roadblock? How would that look? And what would it take for you to not to fear going through a roadblock? What would it take? So that gets them to thinking, I got to make some changes. I can't stay the same. They call it insanity, want something new and doing the same thing. That's insanity. I may mess that up, but y'all know what I'm talking about. So preparation, plan making characterize the onset of preparation. The people, and y'all gonna have to go back and read this because it will take a whole hour I could take this whole time just to teach this. So you need to really know this, because in social work, you are going to always probably use this trans-theoretical model of change, especially if you're going to be working, I would say with anybody, but in particular, if you're working with drug addiction or even people with poor, parenting and healthy relationship. Anyway, you can take this at any component in any system and use this and apply these principles. And then now look here, you've identified the problem. You got them thinking about change. They can admit, yes, this is unhealthy. Now you talk to them. You are that change oriented person. You're leading them to change. You're guiding them, and then now they're beginning to see how life will look like without it, and now they're making preparations and plans, and so now their fears, so that the fears of changing is gone, and then this is what happened. Action is your fourth stage of change. And look on your book. It is characterized by motivation, purposefulness, purposefulness, activity, and optimism. Listen, now go back and connect these dots. You know how we were talking about just a few minutes ago, we were talking about temperance, how people tempers, they lay back and they and courage and all this. Now just imagine if you got somebody who lacks all of that, and then you got them in that action state. That's where it's going to take a skilled social worker to come in and motivate them and help them, remind them of their purpose, remind them, or I can do this, I can get through this. But listen to this. It's important that you read this. Many people at this stage, they drop out. They, because even though they were motivated and excited about it, they drop out. Now here, let's look at it. It's characterized by motivation. I said that you notice actual difference in the person, the situation, the aspects of both. And, everything is looking better for the person, the environment. But listen, however, the activities of this stage may lead to durable change. The intensity may fade. Okay. Sometimes remarkable, quickly change-related activities may not continue. We lose them. And you know what? Because, unfortunately, people change is uncomfortable. It's very uncomfortable. Even if it's healthy change. Sometimes people just go back to what they're used to. Yes, I'm doing this and I can see it, I'm doing it, but I begin to see them bumps and knots and I've been seeing that I can't, and I remember I lose my courage, I'm not motivated. And that's why you have to come in and you have to continue to motivate them and encourage them. But then your next is maintenance. For those who are able to keep on going, then you got to maintain. They got to learn to maintain by themselves. Look on page 373. The fifth stage of change is that process. Read that. Know that. Man, this is, I'm so encouraged and motivated. And just take this, just take any situation. But I challenge you when your people come to you, like we were talking about in class today, and just ask them, well, how motivated are you to change? Well, how can you change? Well, what have you done? What has worked? Are you willing to do something different? Okay, let's talk about it. How can I help you get there? Put that responsibility back on your client. That is incredible good stuff there, y'all. I'm telling you. So, know that motivation may be as much characteristics of a society or a culture as it is a person. Okay, you find that on page 374 at the bottom of your book. You got motivation, capacity. Kind of look at that, those words in italicized. But just know that. Okay. If you have any questions about any of this stuff, you can come back with me and we can talk about it. Then the University of Chicago motivation, capacity, opportunity. I kind of hit on that. Look on page 375 in your book. It talks about that motivation and capacity and opportunity are intertwined. They're together. So if people have the motivation to change, and then there's some opportunity to change, then there's a ability that they have the capacity to change. Okay, so read over that. So in order for people to change, listen, when they present you with a problem, there has to be opportunities for them to do something different. If there's no opportunities for them to do anything different, how are they going to change? So that's why you got to do your work beforehand. What resources are available? Know your resources. You will be a walking guide. Know your resources. Because if someone comes to you want to change and there's a need to change, and they come to you and you don't know the resources or, not able to lead them to the right places, how are they going to change? And motivation is not just based on the person. It's the culture, the environment, what's behind. Sometimes, I did a little work in alcohol and drug, and we used to tell the people, sometimes you have to change people, places, and things. Sometimes you have to move away from those environments and people because they are preventing you from getting the opportunity to change. Because if everybody ain't flying trying to get right, then you might find yourself in the wrong crowd, and that's why you have to sometimes change your change your environment and change people. Make sense? If not, you can. I've been talking all day, but 374 and 375. Look at that. And then look to page 376 in your book. We're going to talk about identifying issues. And what does that look like? And basically, I'm going to take that from your PowerPoint. Look on identifying issues. Becomes essential when it's a life-threatening situation. You have to, in your clients, have to remind them, thinking about your code of ethics, a duty to warn, a duty to protect. And so you have to be able to identify issues that are problematic. And in your book, social workers may identify needs, problems, and other issues that clients do not sometimes may not even see as a problem. For example, I'm going back to that video, which was really good, about the young man who, his problem is that his wife would not let him drive the car in the scenario, the role play. However, from listening to that and continue, I don't think it's not about her not driving the car. It's about your DUI record, about you driving that driver's license and don't tow up the car. So sometimes you have to be able to have those courageous conversations with people, because they can skate all around the issue, and you have to, you listen to that and you thinking, so you have to be able to have that clients are unwilling or unable to share their views. Sometimes they just not able to face that giant. They don't know the problem. They're just not there yet. So it's going to take you to do that. Social workers have different perspectives regarding issues. Read over that. What does the client say the issue is, and what are you have to be able to know those issues. By identifying the issues, it helps you to be able, as a profession, to share opinions about factors that contribute to the client present issue. So if you're not able to identify, for example, I'm just gonna take that scenario. The person who shared that, he was upset about the vehicle, and so if I was a social worker in that case, I mean, for me, I would be like, well, Mr. B, Mr. B. I'm hearing you say that your wife will not allow you to drive the car, and you need to drive the car because your job, and you want to make sure, and you're thinking she just being upset about it. But is it possible that the reason that she's upset because you don't have a driver's license, you wrecked the car, and that you have gotten DUIs? And so they might not be able to say that, but when you're listening to their whole story and what you're hearing, then you might have to point out some things. And so it's really important, part of assessment, to be able to identify the issues, because sometimes people can't. Like for me, I'm just going to pick on myself for a minute. Like I have trouble with my knees and legs, and y'all all know that. Well, I can say I have trouble with my knees and legs, and sometimes I walk, it pops, sometimes it get cold. But the bottom line is, because a doctor have told me that if I just lose at least 10 or 20 pounds, that would help me a little bit, because it wouldn't be putting on. I'm not ready to hear that. So as a provider, he said, well, Ms. Neighbors said, if you could lose 10 pounds, he said 10, just 10, not 15, 10 pounds, that would make a world of difference on your knees and on your leg. And but he had to tell me that. Like, I didn't, all I was talking about was my knee hurt, my knee. And he assessed me, did my whole assessment, and he weighed me and looked at my body composition. And of course, his assessment was well, Miss Neighbors, maybe you need to lose a few pounds. He identified that could be contributing to my problem. I hope this is clear, and I hope you're getting it. If not, holler at me. Okay? Now, this is important. And sometimes sharing hypotheses. Okay, your sharing hypotheses is quite interesting. It's an explanatory and change-oriented hypotheses, and it really reflects on what that person is saying. It's reflect on what they're saying, and then the personal issues in it, and it may involve the client system, but it's also that they telling you what theirs is, and you sharing them with yours is, and it's based on fact, based on research, not just because it sounds good. The skills used to express theoretical opinion, why or how issues occur or persist, what to do to resolve them. When you're sharing that, going back to this is some of the things that may be contributed. Do you think that one of the concerns that your wife has with you is that if you wreck the car, again, that she won't have a way to go back and forth to work, or if you go you get stopped without driver's license, is it possible that they could impound that car, and that would cause just put all that out there, all of that out there. But one thing about sharing is when we express our theoretical, research-based opinions about the how and whys of stuff. So that's important that not your own opinion, because there's research that says if you're driving without a driver's license, sooner or later you're gonna get caught. It may involve aspects of the client system, elements of the environment, and a dimension of issues. Dimensions, you have to bring it back in. The likelihood of you going through a roadblock in this particular area, how often are they happening? So what would that look like if you go through a roadblock? So what would happen in the event that you are drinking, you are intoxicated? Bring it all back. Talk about, just you have to be able, because now some of you probably saying, but Miss Neighbors, how am I going to know all that? Well, that's because you've done your work beforehand. You've done your research. You checked out, you've done all the work beforehand, what you need to do before that client comes to you. So you've done your research, you've done your work, and so you're ready. So you'll kind of have, your pre-planning, okay? Look on page, I want you to, all this is found on page 379, but then functional analysis. You want to know this, and synthesis are used in the assessment process. Functional analysis, it builds upon data collected during the exploring phase. Functional is what you get from that client, what they told you, okay? And then the synthesis, you assembling the pieces of information into a coherent whole. You getting a little bit here, a little bit there to present a whole to your client. And this functional analysis is built on the data collected during the exploring phase. And look on page 10.2. Look on page 382, table 10.2. And it kind of give you some. Have I skipped? Yes, I did. Well, I did. It really started on page 381. And it gives you some functional analysis for focal issues. For example, you got before, during, and after. Just kind of look over those and read over there. You're not going to have to memorize that, but just know that when you're looking at functional analysis, you're looking at the situational and environmental factors. You're looking at cognitive factors, their thoughts and beliefs about it. You're looking at their body sensation, their feelings and emotions before, after, and how they were doing. Just have that. And I'm going to say this to you again. I know there are a lot of books. Like, I collect books. I got books everywhere. But if I were you, I would want to keep this in my toolbox, because and if you rented the book or whatever, I would just want to keep this book, because it's just got some good information, and some that you may not use at this point, but you'll use later on your journey. So I just think it's important. by sharing your hypotheses, it helps you to get a client generated hypotheses and may contribute to change or hinder the progress. So that way you painted a picture, and the picture's out there and it's all their stuff. And they can look at it. And then it may help change their hypotheses about how they initially came to you. And this may, and if you don't do this, then it may hinder the process, or some people may not be ready to face the truth. Okay, so know that. Steps to follow while sharing hypotheses. Okay, now this is important. And all of this, it's on your PowerPoint, and I'm just not going to give you too much more outside of it. But I do want you to know this. Reflect on the client's generated hypotheses. Reflect on what they said. Reflect on it. Not that you're validating, but you're reflecting. So I hear you saying that you don't feel like your wife loves you, and she's not trying to help you because she won't allow you to drive her car to go to work. Or, she will take you, but she will not let you drive a car sometime. Then use your exploring skills to help clients examine their hypotheses in a greater thing. Well, Mr. B, from listening to you and talking to you, you did share with me that you've been you were arrested. You don't have driver's license. Do you have insurance? Have you thought about, what are those consequences, if you were stopped? You're thinking about that, and then encourage clients to question the credibility and the utility of their explanation. Question them. Remember I told you, you don't ever call your client a lie. You say there is no credible evidence to support that. Well, she won't let me drive the car because she don't love me. Well, how long have y'all been married? Mm-hmm. So she's how many times have you been incarcerated? Mm-hmm. Is this the first time that you got your driver's license taken away from you? Whatever they got to say. Okay. Did she remain in the relationship this whole time? Are y'all still living together? Do you all still do things together? Does that sound like somebody who don't love or care about somebody? Do you see what I just did? It takes that client's truth, and then you have to not challenge, but you're sharing the hypotheses, and you're getting them to be able to start, because they may not recognize the problem. So now you're helping them to see, yeah, I am loved. And yeah, I did go to jail. And yeah, I did this. And so, you'll have to, continue to do that. And now listen, no one is expecting you to be able to do this on day one. It takes skills and continued work and lifelong learning and practice. Now, I'm going to be looking for all this kind of stuff, and we're going to have some homework at the end of this so I can see that you're getting it, okay? Steps to follow while sharing. Offer change, or, offer something else. Offer other ways, that reflect a strong, logical, rational, like scientific theory, critical thought, that is evidence-based. Offer something else beside that. Make sure you give it to and recognize that clients right. Listen to this. Now I'm gonna tell you, I'm gonna go. Let me help bust your bubble already. There will be clients that you will give it 120%. They acknowledge the problem. They ready to change, and you do all this paperwork and stuff. And guess what? They get down and they reject it, or they deny it, or they don't. Don't beat yourself up because they said they really wasn't ready for change. Okay, and then propose. If they're not ready for that particular change, maybe they're not ready to stop drinking. Well, maybe if you're gonna drink, you're gonna drink at home and you won't drive. So you have to break that thing down that will work for them till they get ready to be at that change where they are healthy. All over, a healthy individual. Okay, so make sure so it's a skill. You just kind of talk to them, and I've talked with clients and was sharing some stuff with some of them, and they were like, but I don't, that's not, it's not that you're agreeing with them, but you're challenging, not challenging, but you're questioning their thoughts about a particular behavior. I know this was kind of hard to grasp, but I promise you, you'll get it. And if I need to talk to you more about it, I can. But you have to follow those steps after you sharing the hypotheses, and the client may not be truly ready for change. And then as you go down from sharing hypotheses, you have to confirming the issues. And that means the social worker and the client agree to work together toward meeting the needs. Then, like I talked about that earlier in class, the focal needs, because sometimes people can have so many problems, and you're confirming what issues you're going to work on, issues that the participant agreed to address. Because it could be something, like in that scenario, I remember a lot of them, but in particular, I'm using this one. But he had, he couldn't drive his wife's car. He didn't feel loved. Talking about divorce and all of this kind of things. Well, that's a lot to come at you. So, what is the main focal point that we're gonna work on? Should we work on getting you a car? Should we work on getting your driver's license? Break it down and you all come together and talk about that. And it needs to be central to the change process. And you can find all this on page 391 in your book. And one of the things, assume a prominent place in the contract portion of description, assessment, and contract. This description of what the problem is, your assessment, and how y'all gonna contract, how you gonna work it out, and what that's gonna look like for the client. And that helps them to see what their problem is. Okay. Turn to page 393. And we're talking about organizing descriptive information. That's on the bottom on page 393. It allows for easy understanding of efficient retrieval. It helps you to be able to retrieve and remember all the information that was shared with you and get it. And sometimes I know some of you are making little notes, and I make little bullet points so that I can go back, and that's why you'll be able to do that. But you have to be centered to make sure your mind is clear. You don't have a lot of things going on you before you start assessing with that client. Descriptive information involves reported and observed. That just kind of, observed behavior, descriptive, what they saying, but also what you observe. Conclusion and resulting from a speculation or opinions or hypotheses. Read that. Date and source need to be noted. I always document, because if you don't document it, you didn't do it. And then you remember the DAC, descriptive, assessment, and your contract. And we talked about all that. Guidelines for completion of a DAC description of an individual. Look on page 394. Y'all, you won't have to worry about this too much, but I just want you to look at those guidelines, so that you can kind of have an idea. I don't want you to focus on it. I just want you to have that in your toolbox somewhere in case you need it. Okay? And because it almost, to me, resembles a biopsychosocial. But, just look at it. Look at that. And then let's turn to page, because you're going to have homework to help you get through this one. Turn to page 402 in your book, and we're talking about preparing an assessment case formation. And this result as you talking to them after you gathered your information. Your organized structure may be theoretical or atheoretical in nature. It may not be, identification of problems and all those theoretical approaches. It may be some other kind of way, but it has to have some way. There must be preparation and assessment done in order for you to even have a case. And I think I talked about that. It enables the worker and the client to reach an agreement about the theory of the case. And the theory of the case is, how did we get here? What got us here? How did we get to this point? And that's gonna be really important when you're working with your client. Look on page 402, and that'll tell you some things. And this is some steps I want you to know about steps in preparing an assessment. We're almost at the bottom of the page. We're almost done here. Development, and just look at your PowerPoint. It's coming straight from your PowerPoint. No big secrets. Nothing missing. Okay. Preparing your assessment is found on page 406, and we're talking about develop explanatory hypotheses about risk factors and forces that affect and maintain problems. Now you're gonna have to be able to list. You identify the problem, but also you got to be able to have in your mind to be able to list what are those things that keep that problem right present. What are those things keep us from moving forward? So you have to be able to look at their strength, the things that their competence, their resources. Kind of go back to this is tools like capacity, motivation, and opportunities. You have to determine the client motivation, readiness to adhere to the change, or readiness to address a particular issue. And sometimes clients will have issues that they come to you with one issue, like going back to that story I was telling you about, that case scenario. He was coming about the car, wanting the car, but his issues were far greater than that. And so, but he may not be ready to address those issues. His primary thing for coming to see you right then, and the only thing he wanted to work on is just that transportation. And that's what you would do. But also you would have like a concurrent plan or something that kind of, in the event that he decides that he wants to get his driver's license, or the event he decides that he's had enough is enough. As a social worker, you don't react, you be proactive in your working and your assessment. So that's what steps in preparing for the assessment, making sure what protective factors, what are in places, what resources are in place to help that client get to a point where they're able to really change. You want to make sure what resources that are there that will actually help that client get to a point where they can change, because it won't do you no good if you don't have any resources there that's going to help them change. Okay. And look at steps in preparing assessment. Develop change oriented. This is just what you're going to do. Identify the people, the places, the system that can help that client get to that place of change. And who can. Then thinking about Mr. Harris, he identified me. I identified the unemployment and access to resources that I had to help him get there. And then you can predict the probability of if a client's gonna, how are they gonna succeed, and that's based on you can predict probable consequences and risks in the assessment. What could happen? If you don't do this, what are some of the consequences? What are some of the risks if you continue those behaviors? And sometimes you have to identify that, because sometimes people don't see that. They don't see the risk and all those factors. Going back to that case, what is the risk that if he continues to do that, there's a possibility that his wife one day may say, you know what, I'm tired, and she may want divorce. There's a whole lot of things, and it's going to be your role to help them get there. And then consider applicable interventions. What is appropriate, and one of the best thing I want you to look at, what type of time frame do you want this task to be completed? Sometimes people need that to help them. Now we've covered a lot today, and we just covered a lot. I want to give you your assignment. Your assignment will be, I'm going to post this, but on page 406, Chapter 10 summary exercise. And I'm going to put this on Blackboard, what you will do. I tell you what, I know y'all got a lot. We're not going to do that. Let me tell you what I need for you to do. I just want you to complete the self-appraisal. That's it. Answer the first question and do that. That's all you got to do for this chapter. And read, listen to it, and prepare yourself. Homework. Chapter 10, page 409. As you finish this chapter, please reflect on your learning by using the following space to identify any ideas, terms, or concept addressed in chapter 10 that remains confusing to you. I'm going to put that on Blackboard so you can do your homework. And then that will be due. Today is Thursday. And since you only have one page to do, I believe that you can get that done to me by, I'll give you a week, to the 23rd at 11:59. Thank you. And I hope you're taking care of yourself. And we're almost, and remember, I'm going to schedule a Zoom class for the 23rd. We will meet at 1 o'clock. I will cover chapter 11. And from 1 to 1:40, chapter 11. And then chapter 12, I will cover at 1:30, 1:40 to the 2 o'clock, whatever time, that 40 minutes. And then we will have one more chapter, and I will finish that one on video. Well, wait a minute. Yeah. I'll let you know. I'll be uploading this and getting this to you, okay? Thank you. And remember, if you have any questions, you can email me or call me.